Hello, I'm Dr. Leibovitz, your Central Indiana go-to foot doc, and welcome to my FAQs, that's foot and ankle questions. Topic for today, orthotics. A lot of confusion about orthotics. People think that any insole that goes in the shoe is an orthotic, and that's not the case. An orthotic is a device that works, and it's actually for every part of the body that it treats and changes the position of the body. We're dealing with the foot and ankle, but orthoses, that would be eyeglasses that change the function of the eye, while sunglasses don't, but they're both worn as glasses. Another good example is a retainer. It actually changes the way the mouth develops and the teeth develop, but a mouthful of bubble gum does not. So there is a distinct difference. So foot and ankle orthotics are used to treat any type of biomechanically induced problem that occurs in the lower extremity. Okay, our first question. Why are orthotics so hard? Well, not all orthotics are hard, and it's a question between bulk versus strength. Stability. So let's give an example. If we have a table that has a leg that's 3 inches short, how much foam or how much softness do we put underneath there to make it stop at 3 inches? Is it this much? Is it this much? If we put a 3-inch block underneath there, it's very precise. We know exactly what we need. So durability is also a big factor. So that gives us precision as well as length of time. Softness is not really the issue. A lot of times we're dealing with excessive pronation, the foot rolling in or collapsing in. Well, that's a shock absorption part of the body. We don't want to put anything softer in there. That actually would make things worse. So we do use soft orthotics at times, but primarily we want durability and precision of our correction, and that's why they're more rigid, and the materials are pretty more rigid. What's the best type of shoe to wear with orthotics? Another great question. Shoes and orthotics are a marriage, and hopefully it's a good marriage. And the shoe is the foundation for an orthotic. So if we view the orthotic as this custom-built home, and we put it on a foundation of quicksand, it's not going to survive very well. It's not going to function very well. We want a very solid foundation with that. So when we look at a shoe, there's two things that are important. One, that it has an insole that's removable, and should be easily removable if it's designed that way. That way there's no size change on the shoe when an orthotic is used. The second is the stability. A good example of what we're trying to do with stability is on my webpage, go to videos, and under videos there's sports medicine injuries, and look at the Achilles tendon function. That tells you how the foot's collapsing in, and that's what we're trying to do. Now, the part of the shoe that's important is this part called the heel counter. And when you squeeze that real simple test, you don't want it to budge. You want to be able to feel like you can put a vise on that area and not have it move. The sole, I don't care what the sole is made out of, whatever high-tech terms come, it could be air foam, peanut butter, horse manure, it does not matter. It's the rigidity of the shoe. So it's not after a particular brand of shoe, it's after a function. So I don't care what type of shoe, as long as it has that solid heel, I am extremely happy with that. What's the difference between a custom and an OTC over-the-counter or prefab orthotic? That's the difference between correction and cost. A prefab or device, an OTC device, is going to provide some correction, but not a great deal of correction. An example of an OTC device is probably between 1 and 3 degrees of correction, while a custom device is looking between 4 and 8 degrees of correction. Big difference between there. And there's a dramatic cost difference too. Prefab, mass-produced, is ranging probably anywhere from $50 to $75, while a custom device is running in within the hundreds of dollars. There's a place for OTC devices. We use those frequently for small amounts of changes. But if it's significant, it's not going to make a difference. Example, if you were having vision problems and it was a small amount, you could go to the pharmacy and pick up a pair of readers from over the counter, and they may be adequate for you. Wonderful. But if it's aggressive amount of correction needed, you're going to have a pair of glasses that are made for you. And that's the difference between an OTC prefab device as well as a custom device. Okay, there are a lot of imposters out there that say they're custom devices, and it's not the case. And you have to be aware of that, so buyer beware. Example, this is sold as a orthotic. It's not, it's basically a filler insole, flexible. All it's doing is taking up room. You're going to have the same effect by wadding up toilet paper or newspaper in the foot. It's not going to make any difference other than taking up space. Most people feel they need something really soft, so they want something spongy. And these come with an opening. You can actually squeeze them and they are soft. But again, it's not going to change the function of the foot. It just fills up the foot. Most problems are not related to a too much shock absorption problem. This is getting more of a prefab device. It has more of a rigid arch area and a really strong heel counter. This is going to start changing functions of the foot, and now we're getting to the OTC devices that are going to have some work. We have our own prefab devices. It's made by the same company that makes custom devices. It's very thin. Again, it's a limited amount of correction, but it does have more availability in different type of shoes because of the thinness, but it doesn't correct as much. And then we have a custom device, and it looks like an insole, top cover, but it's what's underneath is the important part. This part is designed for the foot. It's taken from the cast or impression it's made from the foot, and it's only for that specific individual. Another person should not be able to wear this comfortably. Okay, so going back to the imposters, one particular is the Not So Good Foot Store. Their devices are basically a prefab or OTC device, and not to say it's not a bad device, because it does improve if you have a small amount of correction, but my concern is they're selling it for a custom device, actually more than a custom device. And I've seen these devices on the internet between $35 and $75, but we're talking $400, $500, $600, $700 for these devices, which is more than our custom devices. They do offer a return policy, but it is a return, not a money back policy, so buyer beware on that. I've had my orthotics for over 10 years. Do I need a new pair of orthotics? Well, it depends what the original problem is. If you're doing well and you're not having the original problem, probably not. It might be worth an evaluation though to see how the foot's functioning. Sometimes your orthotic can be modified to make sure that that covers that. If there's an increased weight, that could dramatically affect the orthotic. The top cover is the biggest concern. Top covers have a lifespan of 2 to 3 years or so. That's not a new orthotic, that's just a new coat of paint. Once you get your orthotics, I usually check in about a year to see how that's functioning. Function-wise of the foot, though, I like to check every 5 years. The orthotic won't change, but the foot will, and that may necessitate a change in the orthotic or possibly a new orthotic on that. I've not worn my orthotics for 5 years. Now I'm starting to have problems again. Well, the equivalent of that, I could see great, now I take my glasses off, now I can't see anymore. We've stopped correcting the problem. Just because you've gotten better doesn't mean you don't need orthotics. That controlling the soft tissue damage, but given enough time, it will return. And that's really a tribute to how well the foot's working. It took that long before it started giving you grief again when the condition was still there. It could be a concern with weight too. That could make a big factor in the orthotic function. Now, I want you to go back to your orthotics. I necessarily have to see you, but go through that slow break-in period. If they worked before, most likely they're going to work again. Make sure you have the shoes, which we talked about already. And I know we talked about the flexibility program. Hit that again and see if it doesn't go away. You should see some improvements within a couple weeks. The break-in's really important. Don't go too fast, full time in them. The orthotics are doing a dramatic amount of change, and too much change too quickly can cause a secondary problem, and we don't want to treat another problem than what you first came in with. How long do I have to wear my orthotics? Well, my smart aleck question for that is as long as you want to be comfortable. If you take the orthotics away, the correction is gone and the problem will come back. The exception to that is children. Children's feet, their bones are like Play-Doh. If we correct them, hold them in orthotic, and they have enough time, their bones will change, and they may not need an orthotic, or at least a degree less of an orthotic than before. So children will actually change if we hold them in the right position. Why do orthotics cost so much? When you look at it, it looks like a piece of plastic, but how the plastic's fabricated, the knowledge behind that, the time, there's a lot of labor involved. It takes almost 2 weeks of production to make an orthotic. You're not going to get a custom orthotic walking in and walking out. There's a lot of labor involved. So that's one of the reasons. It's more apparent than just looking at the top cover. And actually orthotics, when it looks at the big picture of orthotics for the body, are in the lower spectrum of cost. A pair of orthotics versus a single, what they call an FAO, foot ankle orthoses, that's made for more aggressive biomechanics of the foot. One of these is more than twice the amount of a pair of orthotics. And orthotics always come in pairs. It's not like you get monocles on eyeglasses anymore. They always come in pairs because the mechanics are very similar on both sides. And we don't want to cause a leg length problem with that one. Does the doctor wear orthotics? Well, yes, I do. You probably heard me talk about this before. I'm a previous patient of plantar fasciitis. I've learned from experience, if I don't wear my devices or wear the right shoes or do my stretching, it will come back and haunt me. I'm going to have the opportunity of trying all the new devices, new labs, new materials that come out, so I can decide what's best and works best for my patients. So I am the guinea pig when it comes down to orthotics in my practice. Will orthotics help my back pain? Orthotics are really predictable with foot and ankle pain. When we go to higher segments, it's possible it may help, but it's not as predictable. With any problem that we think we're going to treat with orthotics, so we test, whether it's in the upper segments in the hip, back, knee, or in the foot and ankle. We mimic what an orthotic will do with an athletic taping, and that gives us a real good indication in a short period of time how well an orthotic will work. So testing, the proof is in the pudding with that. Will my insurance cover orthotics? That's a whole hornet's nest, and it's very frustrating for us. We have a diagnosis, there's a specific code that's associated with that diagnosis. We have a treatment, there's a specific code, and you should be able to ask, is this covered under this condition? And it should be a simple yes or no answer. And a lot of times we get this nebulous type of answer, and we can call 3 times and get 3 different answers. And that's why we have our patients call. They have to tell you what your benefits are. They can give us all different sorts of stories. So we double check. And I'm going to be cautious if by chance you hear the words medical necessity. That is this black hole that is a term that's used that kind of puts chaos into everything. They won't tell you what medical necessity is. They won't tell me what it is. I've been doing this for 30 years. You think I would have figured it out. But no, we submit a claim and they can deny it or accept it. And you would think, okay, why would they deny it for one person and accept it for another? Transparency would be really nice. So we're going to ask you to check and make sure. But if they say medical necessity, be cautious. That's usually the kiss of death. In the last couple of years, we've also come across the insurance companies say they cover it for diabetics. Well, there are diabetic inserts entirely different than orthotics. Orthotics have nothing to do with diabetes, but it's more hoops that they're making you jump through. It's like saying if you don't have a pacemaker, if you have a pacemaker, they'll pay for orthotics, and I don't understand that. But again, it's one of those blocks that they put up. Medicare does not cover orthotics, with the exception, and this is my favorite part, unless it's attached, the brace is attached to a shoe. We haven't seen that since Tiny Tim and the Christmas Carol, which is 50 to 75 years old. That's just archaic language and they've never changed it. So in essence, Medicare does not pay for orthotics. But if you call them and you ask them they pay for orthotics, they may say yes, they just don't tell you that secondary part. Okay, that's a lot of questions with a lot of answers. With our social distancing, if you become a bit lonely, I suggest checking and maybe fostering an animal. One of our favorite rescue groups is Forever We Love, F-U-R, everwelove.com. They're always looking for great foster parents to help them out with their animals. That way you get a friend for a while and take care of a lot of that social loneliness. If you need some humor, there's a comedian named Charlie Behrens, he's kind of a Midwest comic and that's his flair. He's extremely funny, so if you like the Packers and hate the Bears, I think you'll like this guy. If you have any other questions, submit them on my webpage. We're also on Facebook, or the old-fashioned way, just call up my office. Hopefully this has been a bit informative for you. I'm Dr. Leibovitz, your Central Indiana go-to foot doc.